Welcome to NCLEX Pharmacology Practice Test number 9. In this video, we're dealing with the top emergency and priority medications using NCLEX style questions to help you master them for your clinicals and your preparation for the NCLEX. I'm going to give you mnemonics how to remember them, which medication are emergency medication in this NCLEX practice question test taking strategy, and giving you details information with mnemonics that will help you remember them. Let's get to it. First question, a nurse is caring for a client with what? Anaphylaxis. Keyword, anaphylaxis. Focus on it. Anaphylaxis. Which medication should the nurse administer first? Think about it. Anaphylaxis and first. That means whichever medication you're going to pick should be used for anaphylaxis, but at the same time, it should be the first medication you give. Do you give diphenhydramine, epinephrine, albuterol, or prednisone? Think about it. If you have anaphylaxis, what is the underlying problem and which medication you pick? Stop the video, pick the answer. But what is the mnemonic I will give you to answer the question? This is it. Epi is for emergency. Therefore, the first medication you should pick and you should give to the patient is epinephrine, followed by what? Diphenhydramine, followed by what? Albuterol, followed by what? Prednisone. There's another question that will use this strategy, but this medication is used for allergies, anaphylaxis, and therefore epinephrine is the first answer. So take note of it. Next question. A nurse should anticipate giving which medication? The client in emergency department is experiencing acute asthma exacerbation. The buzzword in the question is acute asthma exacerbation. If I'm taking these exams, acute asthma exacerbation is what I'm going to focus on. Therefore, whatever medication they give me, I'm going to focus on what? Acute. That means asthma patient in exacerbation, acute state. In that state, I need to do what? Opening the airway. What medication I'm going to use? Something that acts fast. What do you think? Albuterol, Montelukast, Fluticasone, Ipratropium. Ipratropium orally, it takes some time to work. Albuterol, nebulizer, going to the airway right away. Montelukast is very good. Fluticasone is also good. They all will work. Montelukast is a long acting. Albuterol short acting. Ipratropium is also short acting, but it takes a long time. Giving them orally is going to take a long time. What is the medication? I know you know it. This is the mnemonic that you can use to answer this question. Alert is what? Albuterol for acute lung emergency rapid treatment. We have a rapid treatment issue. We're giving you albuterol. That's the next thing we're going to give this patient. That's the next thing. So albuterol is our right answer. What is the next question? Which medication should the nurse prioritize? That means you got to prioritize the medication. It should be the first one. All four of them are possible, but we need to prioritize one. That means if you have 1 second, which medication would you choose? The client is admitted with what? Acute myocardial infarction. There's a word there, acute. That's your buzzword. That means it happened right away. Therefore, patients having chest pain, don't get distracted. Go with the underlying problem. Do you give them morphine, nitroglycerin, aspirin, or furosemide? Think about it. It's an acute problem, sudden, right? Chest pain, right? Because they have ischemia. What is the underlying problem? Blood flow to the heart is being affected. That is what is causing the pain. What medication will you give? Morphine, nitroglycerin, aspirin, or furosemide? You know furosemide is going to kill this patient if you give it to them. It will make them hypertensive, worsen their heart and chest pain. So that is gone. Now you have 3 options, 1, 2, 3. Which one will you pick? Think about it. Attack the underlying problem. Always go to the pathophysiology. The pathophysiology is ischemia due to blood flow. I need to improve blood flow. Why are they having ischemia? It's because of a blockage. Either there's a clot in the vessel, right? Therefore, this is why antiplatelets are the best option. Aspirin first for arterial attack because there's a clot, there's a blockage in the artery. Morphine will decrease the anxiety, right? That's why we give it them. The less anxious they are, the more they become, the pain get better. Nitro will make the vein, the artery bigger, but to attack the blockage, aspirin is the best answer. So that's why we give them aspirin. 3 questions. What is your score? Put it down. Each question, stop it, answer it, listen to the way I'm going to approach it, and next time I approach every question like that. Next question. What is the primary priority assessment before starting? That means you got to do something, pay attention to something before you do something. About what? And then she's preparing to give what? IV dopamine. Patient has what? Hypotension. Therefore, I'm going to give the patient IV dopamine because they have hypotension. Why do I give them dopamine? To increase their blood pressure. But what is the side effect, right? Priority side effect of that medication is what you have to check before you give the medication. It's a safe medication administration. NCLEX practice question, pharmacology, test-taking strategy, critical thinking. I'm going to give you IV dopamine. I need to know what side effect would it have on you. Because of that, I got to check if you already have the side effect of that medication or what it's going to cause before I give it to you. What do you think? Heart rate or rhythm? Respiratory rate, temperature, or serum electrolyte? What do you think dopamine will do to you when I give it to you? It's going to increase your heart rate and it can cause arrhythmia. Therefore, what? I need to check it first before I give it to you. So dopamine, danger to the heart. So you need to check the heart rate and rhythm. Which solution should the nurse anticipate? A client in shock require rapid fluid resuscitation. Which solution should the nurse anticipate? The key word is what? Shock. Shock means hypoperfusion. That means I need to improve your perfusion. I need to give you some fluid. What fluid will improve your intravascular system? If you need fluid and electrolyte, check the adapting class and make it easy as much as possible. Whatever stay in the intravascular system is what you give in the patient who is in shock. Which fluid stay intravascular system is the one that has the same concentration as plasma. It should be equal to plasma, which is what? 0.99% normal saline or 1% normal saline. 3% is too much. It's hypertonic solution. Dextrose 5% in water is what? Not good. It's going to leak out. And then 0.45% is less. Therefore, the right solution is what? Normal saline. What is the mnemonic for that? NS, nursing shock solution. NS is always nursing shock solution. Don't forget. So that's the right answer. Which assessment is the highest priority after administration? That means when I give it to you, I should watch for that. And then administer naloxone to a client with opioid overdose. What does opioid overdose do to you? Decrease your respiratory rate. Therefore, if I give you naloxone, what should I look for? These questions are not hard. I do not make it damn hard. I just want you to use critical thinking. They are straightforward. If you overthink it, you get them wrong. So which assessment is the highest priority after administration of these medication? If it's going to decrease or if it's going to improve your heart rate, if it's going to improve your respiratory rate, then assessment is the highest priority after administration is what? Checking your respiratory rate. So number 2 is the right answer. And what is the mnemonic? Naloxone, no opiate, notice your breathing. And so we got to check your breathing. And that is the key aspect of it. And then should prepare for what? A client with ventricular tachycardia is unresponsive. I try to make the question very short, straightforward, to keep you thinking. Ventricular tachycardia, what is wrong with the patient? Unresponsive. What does that mean? Change it into something manageable. The NCLEX practice question. This is not just questions and answers, but practice question to let you think critically. What is ventricular tachycardia that is unresponsive means? Critical thinking tell you that this is a pulseless VTAC. A pulseless VTAC needs the heart to be pumping back. Medication is not effective. Using that strategy, Any medication there should be wrong. IV amiodarone is gone. Adenosine is gone because this is for SVT. Ventricular tachycardia is pulseless, right? Ventricular tachycardia, which is what? VFib. Therefore, do you defibrillate them or cardiovert them? If you cardiovert, this patient is dead. He has pulseless VTAC. Therefore, you should defibrillate. And what is the mnemonic? Shockable VT, beat the ventricle, and the ventricle will wake up. Therefore, we should defibrillate this patient. Which lab value should be monitored closely? This one, straightforward. It's a bonus one. But you have to know because it's an emergency medication. Then let's give IV furosemide for pulmonary edema. Patient on pulmonary edema. In emergency, you give them IV furosemide. What should you look for? Furosemide lead to what? Loss of K. That's what you look for. Easy. Which IV medication is a priority? Which one is a priority? A client with what? Hypertensive crisis, right? Present with severe headache and blurred vision. That means they have urgency, right? They have problem associated with their hypertension. You need to bring the blood pressure as quickly as much as possible. Which medication can do that? Test taking strategy, content, NCLEX practice question, pharmacology, thinking critically is what? You have to give them a pharmacological medication that can drop blood pressure quickly. It should affect the vein and the artery. Which of these affect the vein and the artery? It has to be a good nitrate. Do you see a nitrate there? Labetalol cannot do that quickly. Metoprolol cannot do that. Adralazine cannot do that much. Best answer, nitroprusside. Therefore, and nitro for now. You will drop it now. Right answer, nitroprusside. The 10th question. And nurse is preparing to administer magnesium sulfate to a pre-eclamptic client. What is the primary assessment before giving? You know what magnesium does. If you need electrolyte questions, check adapting class. But magnesium, it puts you down. Your muscle and your respiratory rate are priority. Your neurological status go down. Of course, bowel function may slow down. Urine output may slow down. Blood pressure may come down. But the priority is this. Magnesium, monitor the muscle and the lung. Do you see a lung there or a muscle there? I like a respiratory rate more than the blood pressure. That's what you check. Reflexes and the respiratory rate, very important. Which medication should be prepared after epinephrine? We've done 10 questions. How many did you answer? Put down in the comment. Explain to me which drug that disturb you, which emergency situation you want to know more about. And let me know, and I'll make a video about it. But what do you think? Which medication should be prepared after epinephrine, after you've given patient epinephrine? I talk about this in the second question, or the first question. The client developed what? Acute anaphylaxis after IV contrast. That means allergic induced shock, right? And you've given them epinephrine because you think an allergy related. What is the next one? There's a mnemonic for that. If you can remember them, after epi, when patient has anaphylaxis, there's something that follows. Is it diphenhydramine? Is it prednisone? Is it albuterol? Or is it furosemide? Furosemide is wrong. But you left the 1, 2, 3. Which one do you think? Test taking strategy, once again, is airway problem. Open the airway. And if it's allergy, treat the allergy first. If I give you epi, you take care of the allergy. Which of these medication would still treat the allergy? The mnemonic is epi first and then the DAP. DAP means what? Diphenhydramine, albuterol, before the steroid. Don't forget this rhythm. Don't forget this order. Every time they give you a question on anaphylaxis, I want you to remember that you give them epi, then what? Diphenhydramine, which take care of the allergy. Then you open the airway, which is albuterol. Then you give them the steroid to help with the systemic inflammation. This you got to know. Which prescription should the nurse anticipate? What do you think? A client with severe hypoglycemia is unresponsive. Every word in the question I've said, I just give you the buzzword. I don't want to give you too many words. The buzzword are what? Hypoglycemic and what? Unresponsive. There's two ways you can have hypoglycemia. Either you're responsive and you can talk to me, or you are unresponsive and you cannot talk to me. So the memory trick is what? You're responsive or unresponsive. If you are unresponsive, I cannot use your mouth because you're not talking to me. If you are responsive, then you can use your mouth. Therefore, if the patient is unresponsive, don't give them anything through the mouth. Therefore, I'm looking at the answer choice. If I see oral medication, wrong. 4 is wrong. 3 is wrong. Insulin is going to drop the sugar more. Therefore, IM. So either you give them IM something or IV something. And I don't see IV, I see IM. IM glucagon, which is going to increase your glucose. And this is the mnemonic. Give glucose muscle a shot. Glucagon will give glucose muscle a shot. And so that's the key. Which finding should the nurse prioritize? Which one? A nurse is caring for a client receiving IV lidocaine for ventricular dysrhythmia. We use it all the time. You also have to be aware they can change the question. Patient is getting local anesthesia. All of a sudden, they're getting sick. They will develop what? One of the key features of lidocaine toxicity is neurological problem. That is the key. Dizziness, hypertension, tonic-clonic contraction, and mild nausea. If you have to pick one, which one will you prioritize? I hide the answer choice and I use different word. If I put the word you should expect, you pick it. But I know you know the answer because you watch adaptants. Because you watch, I know you know the answer because you watch adaptant class. What do you think? This is the mnemonic. Look for central nervous system danger. It's lidocaine. Do you see central nervous system dangers over there? Tonic-clonic contraction is equivalent to what? Seizure. That's your right answer. 2 more. A client with status epilepticus require what? Rapid anticonvulsant therapy. Which IV medication is prioritized? Simple. Rewrite it on your own. Straightforward. Patients having seizures. You need medication to slow them down. Which one is an anticonvulsant therapy? Which one can drop your seizure down? Which one will slow you down and prevent from you having seizure? The key word is what? Status epilepticus. The anticonvulsant is a trap. Don't give them phenotime. Don't give them valproic acid. Don't give levetiracetam. Don't give them levetiracetam. Don't give them any anticonvulsant because they are long acting. It takes a long time to work. We want a rapid. We want a rapid medication. So lorazepam is your first answer choice. And what is the mnemonic? Life-saving seizure stop. Lorazepam, life-saving seizure stop. And the last one. Which medication should the nurse anticipate administering immediately? The client in the ICU developed what? Torsades de Pointes after receiving IV or dansetron for what? Nausea. You know what the torsade is? It's a meandering, polymorphic ventricular tachycardia. How do you treat it? What causes torsade? It's what? Prolonged QT and what? Low magnesium. Which medication do you give? If you give them amiodarone causes prolonged QT. That's bad. You make it a torsade worse. Lidocaine will cause more arrhythmia. Adenosine is used for SVT. I see magnesium. I know my mnemonic. Magnesium would twist the rhythm back to normal. And that is the torsade. It's a twisting, measuring rhythm. And magnesium will twist you back to normal. 15 questions, NCLEX practice questions, pharmacology review, test taking strategy. This is pharmacology test number 9. Thank you for watching, and I hope you learned something. If you like this video, share with your friends. If you have a comment, put it down. If you need more, subscribe to Adapt NCLEX. And if you want to join our membership, we have membership. It's very cheap. Few talking to help grow the channel. And so you get more restricted videos, something like this. Take care of yourself. Good luck in your exams and nursing school. Bye.